is Jenna Cooper, and I am at Zenn Plastic Surgery today. And I'm super excited to share with you about my experience with breast augmentation and how it's changed my life.
And I'm Dr. Zenn, and we're really excited that Jenna came by today. This is my new practice in Briar Creek. I've been in practice for over 25 years, but this is something new and exciting for me. And excited just to talk about breast augmentation today with Jenna.
So the process of picking a plastic surgeon is it's very important, and it's also kind of intimidating, especially in the beginning. And I am very used to doing research on where to get my hair done, where to get my nails done, where to get my spray tan from. But you know, surgery is a much bigger deal. It's much more permanent. And I think like my best advice is obviously do your research. You go online, you check their credentials, you look at before and afters, and you get a good feeling like, how am I going to fit in like with the office, and then you want to go in and meet them and the whole staff because they're all part of the journey. And after that, I thought obviously it was very important to meet you and hear about your ideas and your process. And I felt very, very like secure and excited coming in. And I had actually talked to quite a few other people who either have heard of you or have actually met you and know about, you know, all of your credentials. I heard that you actually like train half of the plastic surgery staff around like the area. So I'm like,
I've been around a while.
I'm like, okay, that's fantastic. So I felt very, what's the word? I just felt very confident in your credentials and also just your aesthetic eye in general, because it's an art form.
I have a question for Jen. I think a lot of people would want to know, you're beautiful, you're incredibly confident, accomplished. Why breast augmentation?
Right? Okay, isn't that the question? So I am very passionate about aesthetics. Most people that know me know that. And I like the idea of always improving myself, you know, mentally, emotionally, spiritually, and especially physically. When you look good, you feel good. And I was thinking, you know what, I do a lot of models for charity shows, I do photo shoots, and I don't feel like I'm fitting in the clothes like very easily. And you know, there's some areas I look in the mirror and I'm like, you know what, I could kind of even myself out a little bit because I'm bigger on the bottom. And I got really excited about it. I've thought about it for a while, but recently I was like, you know what, I'm gonna start really doing my research. And then once I met you, I felt so just like secure about everything. I was like, you know what, I've thought about it and now I'm for sure I want to do it. And I mean, it changes like every aspect of your life when you look in the mirror and you think, I look good, my clothes fit well, I can be the best version of myself, so why not?
All right, Jen, so I know that surgery is very scary for people. I'm operating every day, so it's not a big deal, but what was the scariest thing for you thinking about it?
I think the thing that made me the most nervous was just being under anesthesia and hoping that I would wake up okay, wake up and then everything looks great, and luckily that was the case. And I did have a couple concerns like, is it gonna hurt? But luckily it was the easiest process that I could have imagined from actual surgery that alters your whole body. Like, I just woke up and felt pressure. I felt like this is kind of like awkward, and then I looked in the mirror and I was like, but I love it. And you know, just a couple days of being on some pain meds, and then I was good to go. And a lot of my friends have been asking me about it, and that's what I tell them, and they can't believe it. I'm gonna try it for yourself.
Yeah, I think that it's interesting because people do augmentation in different ways, and over 25 years I've been doing it in all different ways. And so for someone like you, it's a shorter operation, it's not under the muscle,
Yeah.
the scars are completely hidden. We've chosen the implant appropriately so you just look perfectly balanced. And I think that makes the recovery so much easier.
Yeah, absolutely. The recovery was boom. It was easy and fantastic and totally worth it.
And you woke up from anesthesia.
Yes, and I woke up and everything was okay. And do you remember the only thing is one time I texted you and asked you if I was dying because apparently I was dehydrated.
Yes.
And I mean, that's what's so cool is that you can actually text you and you know you're there.
You can send me the dying text.
Right, yeah, reassuring me that you are actually going to be okay.
And that's the best thing about cell phones is that patients will not only be able to contact me right away, but you can even take pictures of things that they're concerned about, and I can get them back into the office quickly. And so I think that relieves people's mind also that I'm always there for them.
It does. It's just it's a psychological aspect, like easing their mind. That's what we need to be told it's going to be okay by somebody who knows what they're doing. So that was awesome. So I've got a question. So I know what to expect when coming in. What would you say that somebody would expect when coming in for plastic surgery from the first moment they walk through the door?
I think it's a great question. I think Jenna was incredibly well prepared because you're idea of breast augmentation. What I'll tell you is everybody's different. If you're gonna come to Zenn Plastic Surgery and come and meet me, plan on being here for an hour at least, because you're really going to sit down and spend some time, and I wanna find out what it is that each patient really wants, what's their goals, because I think every patient's different. And interestingly, every breast is different too. You can't just do one type of operation. In over 25 years, I've done breast augmentations in so many different ways, and so I will pull out those techniques whatever they're needed for each patient. And so it's my job as an educator to let the patient really understand what it is that is special about them, what I'm recommending for them, and then even with trying on implants and sizing and doing things to get a sense really of what they want and whether that's realistic. And I will set parameters on patients, because some people, it's too big for their body, is going to cause all kinds of long-term problems, don't want to go there. And also to make sure that they understand it is surgery. And I think that over time I've perfected doing it in a way that's as least invasive as possible and fastest recovery as possible. And we'll even look at pictures, and I'll try to find the exact pictures of what their body type is so they can get a sense of what they might look like. I think that's really comforting for patients too. Now they have a nurse, Joanne, who will spend time with them and answer all their questions as well and be available to them. And then also, we'll leave the consultation knowing what the price will be for the procedure, and really hopefully all the information that they might want, and also leave the door open and to come back or answer questions on the internet or by phone.
Yeah, absolutely. And then they've got their customized plan, and then just pick a date.
And if someone decides they want to do something, as you know, then you come back. And then we really sit down and say, okay, here's the expectations. What's it going to be the week before surgery? What should you be doing to get ready? What kind of things do you need at home to make the process so much easier? And then also, when can I actually get back and do orange theory? When can I do all these things? And it's going to depend. It's going to depend on the operation we do and how the post-operative instructions are listened to. People are actually doing what I tell them. And so breast augmentation is incredibly safe. It's incredibly popular, but every surgeon is different, and every result will be different. We're really more artists than surgeons, and I think picking the right size, picking the right technique,